And also, yeah, keep in mind that these are some people with AIDS are dying patients, and so they deserve the same pastoral care as would be given to any person who is dying and in need of pastoral care. Yes, sir.
It's funny because just listening to Doc and to Pastor Greg, so much of doing a pastoral care, but in Lesotho in South Africa, the first time I began to do my work over there, a lady in the doctor, the head administrator of the facility for people with HIV and AIDS came to me and she said, you know what, you need to take this nugget back to the States. And I said, well, you know, we're pretty advanced there. No, you need to understand, man of God. And she said, why is it that I only meet the pastor when I'm sick or I'm getting ready to die? Why can't I meet the pastor in the hood, in the cut? Why can't I meet him then and formulate a relationship? Can't he let me know his God while I'm still functioning at a positive level?
Amen. Anyone else have anything to add to this?
I'm not a pastor, but as a person living with HIV, I think, you know, for me, if I was sitting in a congregation and I was to hear my pastor say, you know, you can come to me in confidence, then I would really feel, you know, I would really find a safe place to fall. But also, too, I think in terms of educating congregations, we have a church bulletin that's published every week. And the church bulletin publishes job announcements and everything else, but it needs to, you know, put some real information in about this epidemic, one, and the resources that are available, two, because there might be people in the pulpit at any church that don't know about the services that are available throughout the city. I work for Primary Care Health Services, which are 13 community-based health centers, federally qualified health care centers in Allegheny County. It's the best kept health secret in Allegheny County. We don't turn anyone away for their inability to pay. So if you're uninsured or underinsured, you can come and get care. But people are, you know, people aren't coming in as I would think they would. So I think that that being said, that churches can really step up by publishing more information for the congregation.
Very good. Also, even if you have food pantries, I have a food pantry at my church. I do HIV testing through the food pantry, yes, on Food Bank Day, and they're all there to get their food, and they're getting spiritual food and HIV education as well. Many suggestions have been made about why African Americans are so adversely affected by HIV and AIDS. Some ideas have received more publicity than others, but it seems unlikely that any one theory can fully explain the severity of the epidemic. What accounts for the disproportionately high infection rate among African Americans as compared to other groups? And can you speak to the current trends and address specific factors that may impact the spread of the disease? And we have heard a lot about that, but I was wondering, Dr. Shelton, if you could elaborate just a little bit more on that, and then we are going to close out.
Yeah, the only thing that I would add, because I thought that was a pretty great explanation of it, from my perspective as a primary care doctor, is there was an article in the Post-Gazette yesterday about a study that was done at Children's, and I haven't seen the study, talking about how much the fear and avoidance of health care and distrust of healthcare institutions still exists in the African American community now, for obvious reasons. And so as I was thinking about this before I saw that, this idea about how can we, the issue, that fact, I think, is a huge problem. It keeps people from getting tested, it keeps people being treated, keeps people from getting into health care, to talk to healthcare people who could explain things and talk about prevention. And so, you know, again, that's one of my major focus now is what can we do as healthcare centers, a whole bunch of different kinds, all interested in the same thing. What can we do to become more accessible and get people to trust that we're here to help?
I know we need to wrap up, but I really, this whole thing, a lot of things swirling in my head. I had read these before I came, but then yesterday I got the news that a pioneer for black men with HIV passed away. His name is Richard Anderson. And so this virus is still in the killing business. One of the things I think we need to think about from the church community is, what would Richard Allen do? What would he do? What would Dr. King's response be? You know, what would Fannie Lou Hamer's response be? What would Sojourner Truth's response be? What would Harriet Tubman's response be to this epidemic? And we talked about, in the video, it talked about leadership. And leadership doesn't have to be at a national level. Leadership can be at a community level.
Could I just make a comment about women? Because we're talking about trends. You know, I just challenge the church, because oftentimes I manage women, young women who are infected with HIV, who don't have a support group. And it would be so nice to refer them, because I refer them out to many services, but to refer them and connect them to a church that they would be supported, they would feel loved. They have young children, and they're women, young women, that don't know how to be a mother, you know, and they need someone to embrace them. So I challenge the church, if you have a loving spirit about you, would you please give me your contact information so I can get these young women that are broken, lonely, and depressed.
And I envision a directory of services that the churches can provide to somehow be distributed in the community, and certainly that would be a major positive effect upon the AIDS population. But we're going to have to close. We are under time constraints, and unfortunately we're not going to have the opportunity to take your questions from the panel, but they will be available for you to talk to immediately after this session closes. So I want to thank the panel. Please give them a round of applause. And I'd like to say that I'm very grateful to have had any part in this day of awareness, and just like to encourage you and challenge you, let's fight AIDS. Amen. Let's fight AIDS. I'm going to turn this back over to my father in ministry, my former pastor, Reverend Dr. Lauren Mann.